going to be reading you your discharge instructions for home, okay? All right, so for you, we're going to go over a couple things. Diet. Your diet definitely needs to be adequate nutrition so that your body can heal itself from all of this that you've gone through. You should definitely have high fiber foods like broccoli, bran, cauliflower, fruits to help your bowel movements become more regular. You need to eat foods that are rich in calcium, which include dark leafy greens, dark vegetables, milk, yogurt, plenty of water. You need non-sugar supplemented juices, okay? Each day you need to consume these to satisfy your thirst and to maintain your hydration. Avoid any soft drinks, coffee, tea, and alcohol if you can, okay? Activity-wise, gradually increase your daily activities. Don't do it all at once until you're back, with in your normal routine. Rest very frequently if you can. No lifting, pushing, pulling, anything that's bigger than the baby for the first 2 to 6 weeks, okay? Or as instructed by your OB. Don't drive until you're released by your physician to do so, okay? Your breasts and nipples may have changed or grown in size during your pregnancy. Wearing a well-fitted, supportive bra at night may be more comfortable as your body adjusts to these changes that it's enduring. Wear breast pads until your breasts stop leaking. Leaking may occur several weeks to months after you stop breastfeeding. You may apply ice packs between feedings to ease this discomfort, okay? Wear a well-fitted supported bra at least 3 times or at least 3 to 4 days following your delivery. So if you delivered today, wait about 3 to 4 days after, okay? Refrain from stimulating the breasts and nipple. Do not pump breast milk or permit the newborn to suckle to elevate engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs, or ice packs for 15 minutes at a time, every hour as needed, okay? To prevent tissue injury, do not apply cold directly to the bare skin. You can put like a pillowcase or something in between. Don't massage or apply heat to your breasts at all, okay? Breastfeeding tips may be your baby's mouth should be formed. It should form a tight seal around your nipple and your areola. The lips should be against the areola, not the nipple. If your baby is suckling incorrectly, slide a finger in between your baby's lips and your breast to break the suction gently. Don't just pull baby off. Reposition and try it again. How long should you nurse? As long as your baby wants to, which is usually 10 to 30 minutes at a time. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. They're very infrequent intervals. It is very important for your health of your breast to have your infant feed from both breasts every feeding, so alternate if you can. Good signs of nursing include hearing your baby swallow without a clicking sound. We don't want to hear a clicking sound. Seeing movement above the baby's ears. They might wiggle as they're suckling the breast, and not seeing dimples in your baby's cheeks. You and your baby should appear calm and relaxed during breastfeeding. You should feel gentle tugging at the nipple, but no pain for the first few minutes. If you do feel pain, it may mean that your baby is not positioned properly or latched properly, and that the tongue does not extend past the lower jaw. Remove the baby and begin again. Make sure that you wash your hands frequently as you're taking care of yourself and your baby. To prevent infection, always wipe from front to back. Go into the toilet, clean your bottom with a warm tap water if you can, peri bottle, or a bidet if you have one at home. After you urinate or have a bowel movement, do this, okay? It is important you change your pads frequently. Vaginal flow will decrease in amount from bright red to pinkish or brown to yellow tinged or cream colored. Your menstrual period may occur as early as 6 weeks to 2 months after you birth your baby. Avoid any constipation if you can. You may be given or take a mild laxative or stool softener until the bowel movements have returned to normal. Include fluid and fiber in your diet. Birth control. As far as birth control goes, keep the options open with your health healthcare provider, whatever they say, go with that, okay? You may choose to obtain a method of birth control before resuming sexual intercourse. Nothing should go into the vagina for the first 6 weeks after discharge. Penis, toys, anything like that. Sexual intercourse should be avoided until bleeding has stopped completely and you feel physically and emotionally ready for that, okay? Some warning signs: pain, redness, warmth, swelling, drainage, or foul smelling discharge from the incision or the vagina. Discharge usually comes with the bad odor, so just be looking out for that. Discharge, severe headaches or blurred vision changes, temperature over 100.4, or you feel cold, feverish, and have chills. Okay, these can all be signs of preeclampsia, and you can become preeclamptic up to 6 weeks post-birth. Okay, thoughts of harming yourself or your baby, pain, burning sensation, redness, warmth, or swelling in the legs. Breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks, and flu-like symptoms. Okay, you also need to look out for sharp pains in your abdomen, breast, or chest. Any trouble breathing, dizziness, or faintness, crying spells or mood swings that feel out of control. You have no idea where they're coming from. You're not sad, you're not mad, they're just crying. Unable to empty your bladder or urinate without it being painful, difficult, or too frequent. If you feel painful, difficulty, or a high frequency of urination, you definitely need to contact your doctor, okay? Also contact if you have any difficulty with bowel movement. If you have any domestic violence or abuse issues, you can always call 1-800-96-ABUSE. Now for baby sleeping, please place your infant on his or her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Don't let anyone smoke around your baby. Use a firm mattress and a safety-approved crib covered with a fitted sheet. Not a loose sheet, but a fitted sheet. Car seats and other sitting devices are not recommended for the routine sleep. Don't use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. Baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating at all, okay? You can keep the bulb syringe near the baby at all times to clear the infant's throat or nasal cavity in the nose. Clean the bulb syringe well with warm soapy water after each use and allow it to air dry to prevent any bacteria growth, okay? Wash your hands prior to handling your baby. All infants are required by law to be in a car seat. While the car is in motion, children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. Question any unfamiliar persons visiting your home or inquiring about your baby after discharge. If there's anybody even that shows up from the hospital, do not let them see or hold or touch your baby. Do not use monitors or commercial devices marketed to reduce the risk of SIDS. As far as behavior goes, crying is a normal response from the baby. Most likely causes for crying are hunger, need a diaper change, or needing a burp. You should burp your baby after every feed, okay? Calming techniques include feeding your infant, changing the diaper, gently rubbing the back and tummy, walking with your infant, rocking, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend or your husband or your mom. Anybody in your family can help out, okay? Breastfeeding, as far as this goes, your infant should breastfeed around 8 to 10 times per day per their cues that they give off. Be sure to hold the infant close to you while breastfeeding. Baby needs to be cuddled, and skin-to-skin time is very recommended. After feeding, hold your infant upright over your shoulders and gently patting its back, rubbing its back to burp, okay? Your neonate is receiving a Similac or Enfamil diet, bottle feed. If your baby sleeps longer than 4 to 5 hours and misses feeding, awaken your baby to feed. I know it's scary and you kind of don't want to mess with a sleeping baby, but the baby needs to eat. Your infant will generally take 2 to 3 ounces per feeding after the first days of life, and they'll need to eat every 3 to 4 hours, okay? Positioning, be sure to hold your infant close to you while you are feeding. Cuddle the baby while you're feeding. Do not ever prop your infant's bottle to feed. Burping infants needs to be burped every ½ ounce of formula. After feeding, hold your infant upright of your shoulder, gently pat. It's normal for your baby to have any rashes on their skin. It appears with a small red circular areas with a white dot in the middle. It's called a newborn rash. This does not require treatment and will generally resolve on its own within the first week of life, okay? Avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps, usually on the face, especially the nose and around the nose. They'll disappear within the first week of life. Don't pop them, don't pick them, just leave them alone. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring on their skin. It will start in the face and usually progress down to the toes, head to toe, in that direction. If your infant appears more yellow in the next 24 hours than they do now, you need to call your doctor immediately, okay? Your baby needs to be sponge bathed until the umbilical cord falls completely off and that area is completely healed. Using a soft washcloth with plain water, gently wash your infant's face. Bathe your baby from head to toe, saving the diaper area for the last. Mild infant soap should be used on the body. Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if drainage or the discoloration is noted, okay? The umbilical cord will generally fall off within the 2 weeks of life, okay? 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. This is good. This means baby is getting the food that he needs. Over the next few days, your infant's bowel movement, will begin to change from yellow-green to a mustard yellow and will soften in consistency. Not going to be quite as tarry anymore. Your infant should have at least 1 bowel movement every 24 hours, okay? You may need to keep a record of infants' wet and dirty diapers to monitor adequate elimination and hydration, okay? Always wipe baby front to back if it's a female. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. It is normal for a baby girl to have a white or pinkish discharge. The secretions are normal and will gradually disappear. For your uncircumcised baby, always wipe back to front. Baby from front to back. Always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash, pat dry, and diaper. Circumcised babies, you're going to always want to wipe baby front to back. Again, make sure that you cleanse all creases and folds just like before. Pat dry and diaper. Vaseline gauze is applied to the circumcision area with every diaper change for approximately 24 hours. So make sure you clean it real well. The head of the penis will appear very red, bright red initially, and then it will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your doctor. The plastic ring method of circumcision does not require dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green discharge or drainage, you should contact your doctor. To cleanse the area, wipe gently with a soft cloth, cotton swab, or a gauze pad and plain water, okay? Dress your infant as you would yourself. Avoid overdressing. We don't want to overheat baby. Too many blankets and clothes can cause this. Infants should all receive all recommended vaccinations, and you will get a hold of your physician to share more on that, okay? Do you have any questions for me? Awesome. Well, congratulations, Mom. I'm proud of you. I'm very happy. The tech will come around soon, and we'll get you